Good evening, everyone. I am Phyllis Ellis, president of the NAACP's Brockton area branch. On behalf of our branch and our long-standing amazing partner, AdMeTech Foundation, our health committee with former President Steve Bernard, Leona Martin, and Janet Trask, we would like to welcome our distinguished guests, our members, visitors, and to all that are watching this evening to another outstanding prostate cancer event. Our host for this evening's event is Steve Abrams, who is the chair of the NAACP's Brockton Area Branch Armed Services and Veteran Affairs Committee. Steve, good evening.
Good evening, Madam President, and thank you. Thank you so much. Yes, my name is Steve Abrams. I am the Armed Service Veterans Affairs Committee Chairman for the NAACP Brockton. I have served in the United States Navy and United States Army retired. It is my distinct honor to stand before you during Veterans Week and Veterans Month as we gather to remember the courage, sacrifice, and enduring legacy of those whose shoulders upon which we stand. You see, tonight I bring greetings from the Ancient and Honorable Artillery Company of Massachusetts, where I serve as a sergeant. This is the oldest chartered military organization in the Western Hemisphere, established in March 1638 by the great General Court, Massachusetts Bay, signed into charter by Governor John Winthrop. This company has stood as a living testament for duty, tradition, and service. In recognition of this historic role, the company was granted the fourth floor of Faneuil Hall as our permanent armory, a space that dates back to the building's original construction and remains a sacred site of remembrance and military heritage. It is where I echo the sentiments of this partnership concerning prostate health in our veterans community and beyond. I want to extend my heartfelt thanks to the leadership of the NAACP, Brockton and AdMeTech for allowing me to serve as the master of ceremony this evening. It is a privilege to stand with you in reaffirming our shared commitment in health equity, dignity, and community. You see, our partnership with AdMeTech Foundation stands as a model of purpose-driven collaboration. Unlike any other organization, AdMeTech has distinguished itself through the intersectional lens that place equity at the center of its mission. Their work doesn't merely inform, it galvanizes. By building intentional alliances with historically Black institutions, faith leaders, and community organizations. AdMeTech has developed a cultural responsive framework that speaks directly to the lived experience of Black and Brown men. This approach, anchored in justice, early detection, and systemic reform, has positioned AdMeTech as the national leader in the fight against prostate cancer disparity. AdMeTech's leadership empowered us with the critical data analysis needed to inform and engage our community. Even today, the data continues to reveal a stark and disproportionate number of African American men dying from prostate cancer, often due to lack of detection, late detection, limited access, and screening. You see, in this partnership, building trust beyond traditional health initiatives, it was essential. AdMeTech didn't just offer resources, they cultivated relationships. Personally, working alongside their leadership, I witnessed a mutual commitment to accessibility, transparency, and responsiveness to the questions and concern arise from our community. That level of engagement was not only noted, it was deeply valued. During, during one of our early community education engagements, which had launched my advocacy, I recall a Dr. Jennifer Ryder. I'm dating myself. I can see Dr. Stern smiling now. You see, Dr. Ryder is an assistant professor at Boston University and a leading researcher at the Shipley Prostate Cancer Research Center, widely regarded as one of the most respected epidemiologists in the field of prostate cancer, a true disease detective, controlling public health threats by collecting and analyzing data. This partnership then translated those findings into actionable strategies that protects our community. Their presentation of findings and the ongoing training led in partnership was nothing short of awe-inspiring. It ignited my own journey into prostate cancer awareness and advocacy. Through this partnership, we haven't just raised awareness, we have saved lives. That's more than I ever imagined possible. So we want to thank everyone for taking the time to continue to be the beacon of hope that early detection could save lives. And we want to thank one of our new recruits in collaboration, New Heights Charter School of Brockton. We thank you for picking up the mantle, Wanda Pierre, Public Relation and Community Manager. Thank you all so much. And once again, we're going to continue with this prostate awareness. And I'm going to introduce at this time one of our historic churches in Brockton, Reverend Creighton, who will provide his prospect on prostate cancer awareness equity program and proceed with the opening prayer. Reverend Creighton, you have the floor, sir.
Well, certainly, I find this to be a great opportunity for clergy, especially in the area of the ignominious disease of prostate cancer that was taking the lives of many of our young men.
Yes, sir.
And older men as well. I don't know any congregation where there's not an issue with prostate cancer in it. We have some who, as I speak, are dealing with this issue. And in the past, it was real hope for folks that happen to pick up that cancer and be healed from that. But since this PCP program that we have, Dr. Stearns introduced me to, I've seen an amazing drop in the death by prostate cancer in the Brockton area, which
Yes, sir.
energizes my will to be involved with this program. And I like the concerted efforts that's going on with lay clergy and even a school now and houses of education and so forth. And so I'm excited about this opportunity, and I can see the progress that has been made
Yes,
to
sir.
become part of
Yes, sir.
since 2016. So I'm just happy to be here and to do whatever I can if I can make a difference in my leadership and in my participation. I'm willing to do that on especially a volunteer basis. So I'm happy to be working with so many distinguished leaders in our community here, from the charter school there and what's my friend, but Campbell,
Yes, sir.
Campbell and so forth, and all these people that have been uh, brothers to me since I've been in this area. So I'm just excited. I don't have a whole lot to say about that. I'm sure you all have some things more directed, but I'm just excited about being part of the program. And we're getting a lot of views on our broadcast with the cancer issue and so forth. So
That's right.
we're going to do our part, and I believe together we can be more effective than just going Lone Ranger style. So I'm excited about being part of this group.
Yes, sir.
I pray for your continued success in this endeavor. And we'll go into the prayer right now.
Yes, sir. Yes, sir.
God, Father, we thank you, the author and finisher of my faith. We thank you
Oh,
for
yes.
those who assembled here today by virtual presentation, Lord,
Yes, sir.
educators, Lord, medical staff,
Yes.
and so forth. We're here to make a concerted effort towards making a dent in this ignominious disease called prostate cancer. Lord, we thank you for this opportunity. We thank you for the healing that's going on through this program.
Yes.
Empower us and those who feel like giving up their efforts, Lord, that you would encourage them, inspire them to keep on keeping on, Lord. We realize it's a Herculean task, but we ask that you, Lord, just give us a sign that we're doing what you're calling us to do. Because for you said in your word
Yes.
that whatever we do unto the least of
Yes.
little ones, you do so unto you. And Lord, we are trying to reach those who
Thank you.
are on the fringes of society, who are who are not looked at like they should be, and we thank you that we can reach that audience, reach that group that we're concerned about, Lord. We ask you to continue to show your show your hand on this program, but be ever so careful. Give thy name the praise. In Jesus' name we pray. Amen.
Amen. Amen. Thank you so much, Reverend Cray. And yes, Bishop uh, Apostle Campbell is your brother in arms. You gentlemen aim high.
Yeah.
Thank you. Thank you. And it's that this time, you see, this is the uniqueness about this collaboration and this community. We have a legislative support that has been stellar. They have not wavered since I've been introduced to this prostate awareness and bringing the numbers of cases down. And we're going to see if our legislative leaders are on at this time, because we have an introduction of Senator Michael Brady, if he's on. If he's not on.
He is not, but Bridget Plow and
Yes, we're going to go through the.
Representative Plow, Representative Mendez are here.
Yes. So seniority, we're going to go ahead and move through the process. We're waiting for Senator Michael Brady, who's a true champion, and we know him as a supporter of AdMeTech. So at this time, we're going to ask State Representative.
Hello, I'm sorry, it's Mike Brady. I was trying to unmute. I'm not good with technology, so but thank you. I don't want me to interrupt, but I'm at another event tonight to raise money for Neighbor Works, which helps out a lot of family with mortgage issues in both Brockton and Quincy and the South Shore, and they've been helpful to a lot of constituents. But I want to say thank you to everybody on the line. I'm doing it via my cell phone, and it's been a great team effort by a lot of people. And of course, our good friend Steve Bernard, who got us involved with it. But as you mentioned, at the state level, we have a good team that works together and to get the funding in the budget that's so crucial. And everything that we put in there has passed. It just hasn't been appropriate yet, but hopefully that will happen soon. And despite the nervousness with the federal situation, I think we're in good shape in the Commonwealth of Massachusetts.
Senator Brady, we want to thank you so much for those words of encouragement, and you truly are one of the anchors from day one, and we appreciate your legislative support. And I personally know.
Thank you. And I've known a lot of you that are on the line, and I want to say that no one does this job alone. We have a great team effort from our community in the Brockton area, and even out of at the state level as well. So I want to thank everybody who's a part of this team.
Thank you so much, sir. And our next welcome address, State Representative Rita Mendez, one of the rising stars of our prostate cancer awareness. If she's on the line, could you go ahead and introduce yourself?
Yes, hi. Thank you so much for that. So it's always a pleasure to be part of this event, especially knowing that the cause is there and that we need to really raise our voices and our microphones and let people know about this issue. The fact that Black men, Latino, people of color, men of color are 2.5 times more likely to get prostate cancer just because of early detection can save lives. And the fact that they delayed, whether it's stigma, whether it's cultural, whether the many issues are, it's unclear. But we know it's real, we know it's there, and we know we have to do our part to make sure we're spreading the word. So this is, I appreciate all that everybody is doing. This is really a collaborative approach. We work very hard to get the funding, but we know the job is being done. We know lives are being saved. We know that we can do more, and that's why we keep on speaking about this. But we are actually on the right track. And the numbers shows, and the many people that we serve shows that, and we all deserve a high quality health care, and that deserves, irrespective of a race, color, we should really all be focusing on that. So I thank you all for being here. I look forward to hearing the testimonies. I look forward for this event. It's always great stories that we hear, and many lives are being saved because each one and every one of you are really stepping up to do this work. And I appreciate and I'm thankful for all of you. So thank you for that. Thank you for the opportunity to speak.
Thank you so much, State Representative Rita Mendez. Like I said, one of our rising stars. And this is the uniqueness about this collaboration. We can all come together, even if we're different sides of the aisle or different worldviews, but we do care about uh, prostate cancer awareness and healthcare for all. So thank you so much for those words of encouragement. And up next, the junior state representative, newly elected, Miss Bridget Pluck, as one of our champions, Massachusetts Prostate Cancer Program. Could you please introduce yourself?
Yes, thanks, Steve. Hi, everyone. As
Hi.
Steve so nicely introduced me, I am the new member of the Brockton delegation, but not new in familiarity to this issue. I was a staffer for many years, leading the charge on AdMeTech's prostate cancer research
Yes.
and awareness line item in the state budget. We spent
Yes.
many budget seasons really pushing and advocating for that funding, which has paid off in recent years, where we're lucky to not have to file an amendment because they see the great work that is being done. They see the changes that are happening in our communities,
Yes.
the difference that you all are making in everyone's lives. Dr. Stern and AdMeTech are great advocates. Everyone at the State House knows them. They all know who you
Yes.
are. They know what you're doing. They know that you're doing a great job. And I think now more than ever, at a time when healthcare is really under attack in this country, it's really important that we continue speaking up, continue talking about early detection and how it can improve
Yes.
your life, right? Because that's what it comes down to. If it's detected early, it's highly curable. So we need to make sure that men are getting out there, getting tested, and that they're aware of this disease. So thank you all for the work that you're doing. Thank you for being here tonight. Thanks for all you do for our community. And I look forward to continuing our partnership.
Thank you so much, State Representative Bridget Pluff. Like I said, this is a unique opportunity because your family name precedes you, and your service to the community is well noted and documented. We want to thank you so much. And also we have, if he is here, um, I would like to introduce Mayor Robert Sullivan, if he's on.
I am, Steve. Thank you very much. And I want to thank President Ellis and all the members of the NAACP and Dr. Stern and AdMeTech. I've been on this for a very long time, and I'm really thankful for the endeavors because quite honestly, we're in the people business and this is saving people's
Yes.
lives. And it came to my attention many years ago when I was on the city council. Steve Bernard said to me, it's disproportionate men of color coming down with prostate cancer as opposed to white men. We filed a resolve. Steve came before us, educated us, informed us. And then years later, my dad came down with prostate cancer, and he's a survivor through radiation. But I'll tell you right now, what you're doing in terms of making sure men understand that they need to go see their primary care physician on a regular basis. They need to get the exam. Even though nobody wants the exam, you have to get the prostate examined. And then you have to know your PSA numbers. You have to do the blood test to get your PSA numbers down. So again, this is my last official time as mayor to be on this forum, but you will see me again. It's just too important to walk away from this charge. But I really want to thank everybody because we have a really great group of folks here. The pastors and the clergy, their reach is so far to educate and inform.
Yes.
But I did want to say to Dr. Stern, if you had any information that you wanted us to provide to our Board of Health, we now have, thanks to Governor Healy, we now have a Health and Human Services Commission. The Board of Health is going away. And really, at the end of the day, our job is to make sure that we can try to help as many people as possible. And that's why I'm here today. And I want to thank President Ellis for always inviting me. I see Mr. Hall on. And again, there's just so many people here that have a vested interest in making sure we have a safe community, but more importantly, a healthy community. And it starts with what we're doing tonight. So thank you very much. And I'll listen and learn, and we'll keep advocating together. Thank you.
Thank you so much, Mayor Sullivan. This is the uniqueness about our city. This is Brockton's own bred and born Mayor Robert Sullivan in his last trek around, but he will always be part of what we're doing And hopefully we can get on the links and Mr. Bernard can take care of showing how to bring them numbers down.
There you go.
Yeah, yes, sir. Thank you so much. Up next, once again, leadership reflects performance. And one thing that I've learned being a part of this organization, I've watched leaders. I've watched them move through the process. I watched the meetings. I watched the good meetings and the tough meetings. But one thing that's always stood true is our branch president, Phyllis Ellis, has always stood the test of time in pushing forth the agenda that we can have a more perfect union. So at this time, I would like to reintroduce our Madam President, Ms. Phyllis Ellis.
Oh, thank you, Steve, for that nice introduction. I want to talk a little bit more about our partnership with AdMeTech Foundation. It's actually over 10 years old. We have been associated with Dr. Stern and AdMeTech, and it did start under the leadership of Stephen Bernard. And I think the first meeting was at Reverend Creighton's church.
Yes.
Almost 10 years ago. And the
No
reason they
compliment.
chose Brockton at the time was because we had the highest mortality rate among Black men. But I am proud to say that to this date, that is no longer the case. Brockton is not up there with the highest mortality rate. And I do believe that's in part to all these events that we hold dear to us. But I want to take this opportunity to reach out to Mayor Sullivan because you have been there from the beginning. Every time I call, you say, Phyllis, I'm there. Whatever you need, I am there. And we have had a lot of events, and you have always been there. So we want to take this time to show you our appreciation for your leadership and your dedication by presenting you with an award. Okay? And the award reads AdMeTech Foundation and Brockton's NAACP's Leadership Award 2025, presented to Mayor Robert Sullivan, timeless champion of prostate cancer education, research, and health care equity. We cannot express how much you have meant to us coming on all these years, even through COVID. We truck it on. You were there, right there with us. So we want you to take this award. It will be mailed to you shortly, but this is our way of showing you that we really appreciated you all through these years. So thank you, Mayor Sullivan.
Thank you. I'm honored, and I'm really a privileged to know each and every one of you. And thank you for your kindness and your generosity. And I'm really honored. Thank you.
Okay.
Let me come off mute. Thank you once again, Madam President. And at this time, like I said, our community, we are multifaceted, multi-talented, and we all can come together for the greater cause. And the gentleman that I'm going to introduce at this time is Mr. Darren Durrett, Director of Communication, Brockton Police, and a prostate cancer survivor. I met this gentleman when I was working under the Coffin administration, and he had such a wealth of knowledge, media knowledge, professional knowledge, but he wasn't aware of the prostate health initiative. And when we introduced it to him, he really took a hold of it, and he reaches different avenues of communication. And then this gentleman, like I said, he is a survivor. So at this time, my friend, Mr. Durrett, Darren.
Thanks, Steve. It's great seeing you. It's great seeing everybody.
You look good. You look good.
And it was 2018 when I got hit with the kind of news that really makes your world stop. My doctor told me that I had prostate cancer, but he didn't just say I had it. He said I had a very, very aggressive form of cancer. My Gleason score was a 9, and he told me, your cancer is on the move. We may not have much time. And I'll be honest, if it weren't for the local NAACP chapter and AdMeTech Foundation, I may not be sitting here at all right now. They pushed awareness. They wanted men like me, men who, I'll be honest, I often put off getting checked. I mean, I went to several of these meetings that AdMeTech had, didn't get checked. Eventually, I did, and boy, it was startling to find eventually that you had an aggressive form of cancer, that aggressive. Because, you know, a lot of times with men, it's a slow moving disease, but that's not for everyone. Mine wasn't. At least by the time I found out, the doctor said, it looks like it's contained in the organ, but the way it's moving, we may not have much time. So we acted accordingly. And here I am today. What he told me was that if I had done nothing within that next 5 years, I may not be here. I may be dead. Well, that was 7 years ago. And I'm glad to report that I'm still here, still talking with you. And I want to thank every one of you for continuing to do this. I pass this information along as much as I can. I'm extremely grateful. My family's grateful. And I want every man, every family to know that, again, this might be slow moving, but it may not be slow moving for everyone. So don't gamble with time. Talk to your doctor. Talk to your family. Get checked. Don't let it take your future. Don't let it take your life, because it doesn't have to. And the good folks at AdMeTech and the local chapter of NAACP helped me see that, and I'm glad that I'm still here today. Thanks, Steve.
Thank you.
Thank you so much.
Steve,
Yes.
can I interject for 1 second so we can
Please do.
recognize
Yes.
Reverend Alicia Johnson from Messiah Baptist Church? Reverend Johnson, thank you for coming on.
Yes, ma'am. You're very welcome. Thank you for this.
Okay. Steve?
Yes, thank you, Reverend Johnson. At this time, we're going to go ahead and move forward. You see, that testimony has allowed us to witness a miracle, and that's what keeps motivating us, and we're self-propelled. This collaboration is self-propelled. We just have to continue our true north, and things work themselves through the process. But because we have the expertise, the skill set, the next individual that I'm about to introduce is one of our champions, one of Dr. David Einstein. You see, Dr. Einstein is a leading medical oncologist at Beth Israel Lahey Health System and Dana-Farber Cancer Center and Harvard Medical School. He specializes in clinical care and research in the genitourinary malignancies, including prostate cancer. Dr. Einstein has been a leading research to advance precision treatment, including immense-based genetics and molecular therapy. His research is also focused on advancement of non-invasive biomarkers critical for designing personalized patient management strategies for men with prostate cancer, new tools to improve quality of life, physician communication, and end-of-life decision-making for patients with genitourinary cancer. Dr. Einstein has authored multiple publications and peer reviews, journal. He had won prestigious competitions for research grants from the National Institutes of Health Department of Defense and other public-private organizations, including Prostate Cancer Foundation Challenge Award and the Koch Institute Bridge Grant. Ladies and gentlemen, Dr. Einstein.
Good evening, everyone. Thanks so much for that very, very kind intro. I'm just going to share my screen right now. So happy November, happy Thanksgiving in advance. I am a medical oncologist at BI, soon to be joined with Dana-Farber, and I'm very happy to be here with you tonight to talk a little bit about some myths in prostate cancer, but also some breaking news, because we're always learning more, which is the really exciting part of our business. So these are a number of myths that I like to talk about, and I'm going to go through each one of these in a little bit of detail. But I thought we'd kick this right off since there's a lot to cover. And I think that one very common thing that you sometimes hear about is that prostate cancer itself is common, but we don't really need to diagnose it so much. You know, many people are going to die with it, but not of it. And it turns out that really two things can be true all at the same time. Prostate cancer is both the #1 diagnosed cancer in US men, and the vast majority of people with prostate cancer will not die of prostate cancer. However, it's also the #2 leading cancer killer among US men. So clearly, even a small percentage of a large number of people is still a large number of people. And it's really not one disease. It spans a very wide spectrum, everything from prostate cancer that may not even need to be diagnosed, hopefully not treated, to potentially lethal disease. And so we really have to do a good job of figuring out which is which. And this information all comes from the American Cancer Society. Importantly, something that they point out here is that we're still seeing disparities. And we do know that men of African ancestry, Black men, have twice the mortality of white men for prostate cancer, among other cancers. This is a problem, and this is something that we desperately need to address. Probably a mix of issues with access to care and also some biology that we need to get at. I think that the prostate cancer screening conversation is a very complicated one. And I will say that this has been particularly controversial, more so than for other cancers. It turns out that proving that screening for cancer saves lives is very hard to do these trials. They take a really long time. It's hard to convince people to get randomized to one strategy versus another. And overall, sometimes there's been a criticism that screening maybe only picks up lower risk cancers, not the more problematic ones. Maybe some of the screening studies that are done have targeted men who are on the older side and less likely to benefit. It turns out just because you tell one group of patients to do things one way and another group to do it another way doesn't necessarily mean that's actually what happens. And so sometimes the people who were supposed to be the non-screening groups in these studies actually did get screened. And so you end up seeing no difference when there should have been a difference. And maybe we just need to be smarter about this overall. The other real challenge here is it's kind of a good problem that people tend to do very well with this diagnosis for a long, long time. So you actually have to follow them for a long time before you can get the data. So I wanted to share with you something that's really hot off the press, as in like last week. And this comes from our #1 journal in medicine. So a major report out from a study that's now been following patients for an average of 23 years. And I wanted to go through some of these results again, because I think this is so pertinent to today's conversation. Importantly, they were able to really hone in on the benefits with longer follow-up than what we've had in the past. And something that I highlighted here is that if you diagnose 12 men with prostate cancer under a screening program, you can prevent one death, 12 for one. That's pretty incredible. And that's actually much better than what these data looked like previously. It turns out that screening has some downsides, and we need to be cautious about this too. So you do end up diagnosing additional cases of prostate cancer. It's not clear that all of those diagnoses needed to be made. And so we do see that people who are getting screened for prostate cancer, there is an increased rate in low-grade cancers getting diagnosed. Not all of these necessarily need treatment. But I think the really important take-home message is here that results are getting better with longer follow-up. They're getting better, not worse, and that's actually really important. And probably the data that we have here are kind of our worst case scenario. And that's probably because, first of all, this was starting probably too late. They were targeting men in their late 50s and 60s up until almost 70. We think that probably it makes sense to start a lot earlier than that if people are going to truly benefit. This is a study primarily of white Europeans. And so this is not necessarily applicable to all groups or to people with family histories. And so those groups probably benefit more than just an unselected, relatively low risk group. And really importantly, I said that, we have to follow men for a really long time to get a sense of these data. But that means that by the time we get the data, the diagnosis and treatment approaches are already outdated. And so the harms of screening are actually a lot less than they used to be, which is something I'm going to come back to in a couple of slides. So really interesting data, really important, and really reinforces the message that it's time for the pendulum to swing back towards screening when it had swung away from that for a long time. I think there's a flip side of this. Sometimes there's a message that everyone should get screened for prostate cancer, and that's also not the case. We need to be smart about it. These are the recommendations that come from the government at the moment. They're kind of wishy-washy, and they're actually in the process of being updated. So I think we're going to see some major updates in light of these new data. And, this grade C sort of says, have a discussion with your doctor, talk about risks and benefits. It doesn't really come down on one side or the other, but it does clearly say that if you're over 70, probably it doesn't make sense to routinely do this. Now, I get a lot of questions these days in clinic about, what about President Biden? Shouldn't somebody have been checking in him? And I think, I don't have all the details. I'm not his doctor, but an important consideration here is that screening, by definition, is only in people who do not have symptoms. Okay, so once somebody has symptoms, and we can talk about what those might be, this doesn't apply. Okay, so this does not mean cover our eyes and never pay attention to guys who are over 70. This just means be thoughtful about who's most likely to get benefit from testing in the absence of any kind of symptoms. Okay, and importantly too, I think that we talked about certain groups being at increased risk. Prior history, family history, and importantly, Black men do have higher risk, and we really should be focusing on a younger age group. Now, sometimes I get the sense that people think that it's just sort of a cascading effect, where once you get a PSA checked, it's just going to lead to downstream problems. I'm going to have to get biopsies and surgery or radiation. I'm going to have all these problems as a result of, just getting one blood test checked. And it turns out that we're a lot smarter, not only about screening, but also in making diagnoses. Okay, so it used to be that basically we would do a PSA check in the blood. We'd also do a rectal exam, which fortunately we don't have to do anymore. And that would definitely lead to a biopsy if it was abnormal. These days, more commonly what's happening is based off of a PSA alone, and usually not rectal exam, we're using MRI. And this is just what that MRI looks like to a radiologist. And they can actually go down this scale and see what are the very riskiest lesions that truly need to be biopsied. And we can actually target those lesions in addition to sort of more blind strategies. And some of the patients will have stuff that looks like this, and it's really not of great concern. We can actually safely skip a biopsy. We can try not to diagnose a guy who doesn't need to be poked and prodded, or may have a low-grade cancer, but it probably doesn't need to be treated. So that's a real sea change in the approach and really minimizes the risks associated with screening. Now, this is a sort of general paradigm with how we think about treatment for prostate cancer. There are people at this very low end of the spectrum who actually probably don't need to be treated at all. We can use a program called active surveillance and really just follow them closely. It's very, very safe. And conversely, there are people who truly do benefit from being treated, and we figure out who those are, and we offer them, different modalities, each of which have their own potential side effects, but really a lot better than older techniques. We're a lot better than we used to be about maximizing quality of life, which is obviously super important as well. As far as the PSA itself in the blood, so I think the caveat with this is that it doesn't 100% say, yes, you have cancer, or no, you don't. Okay, there's a lot of things that can make PSA go up and down, which is why it's been a little bit controversial about how to roll this out. So, we're used to interpreting these very carefully. We can kind of normalize this and think about, okay, is this super high because the guy's prostate is just big from old age, or is this truly something due to cancer? We have ways of figuring that out. We can also follow PSA over time. Things like infections will sometimes make PSA go up for a little while, and then it comes right back down. Just because your PSA is normal doesn't mean you don't have cancer. Just because your PSA is high doesn't mean you do. Okay, it really requires a little bit more interpretation. Now, cancer is scary. That word has a lot of weight attached to it, and for good reason. But I will say that prostate cancer is not, as sometimes people worry, a death sentence. Even those patients that come to my office who have metastatic prostate cancer spread, throughout their body, even President Biden, this is something that we can oftentimes control over the long term for many, many years. These are just, clinical trial data, and you can sort of see that they're having to follow patients for many, many months in order to see how they do. And even then, the majority of them are still alive on these different treatments. And this is sort of just a schematic showing that all along the course, we basically try to pull out all these different tools and make this as much of a chronic condition as possible if we can't get rid of it for good. So very often we can get rid of it for good with surgery or radiation, but for those people who have cancer that's spread outside the prostate, we have a lot of different tools that we can try to make this really more like managing diabetes or blood pressure. Okay. Now, some people say, well, I don't have pain. I can't have cancer. And I will say that most commonly, I see patients who really had no symptoms, hence the need for PSA testing and screening. But also, a lot of guys will have urinary issues. Sometimes this could be related to cancer. Sometimes it could just be from having a big prostate, or both. So we have to look into that a little bit more carefully. Sometimes, and this is the kind of stuff that we really, really want to prevent, we want to detect prostate cancer before it's done this kind of stuff, is pain, showing up with, large number of metastases in the bones, weight loss from uncontrolled cancer, low blood counts, anemia, kidney failure from blocked urine, or even breaking a bone. These are the kinds of things that sometimes patients show up in the hospital with, and this means, we wish we could have gotten to this sooner and prevented this bad outcome. We can still treat it, but we'd like to catch that beforehand. I think that a lot of folks are very interested, appropriately, in what to eat and what to do in order to play a role in prostate cancer. It's a really important question. I think that the message I try to give is that really prostate cancer is not your fault for eating the wrong thing or not exercising enough. It's mostly bad luck and aging, okay? And that's just the honest reality, is that sometimes there's things that, we cannot control. And yet, there are a lot of things that diet and exercise can help. So for example, there's some suggestion that exercise can help decrease the risk of aggressive prostate cancer. And it may, help manage existing prostate cancers or prevent them from becoming more aggressive. I think really most importantly, the better you take care of yourself, if you're unlucky enough to get this diagnosis and need treatment, being in good shape, having eaten right and exercising, that really helps you get through treatment better. It helps take care of the rest of your body. And importantly, most people don't die of prostate cancer who have prostate cancer. They'll die of cardiovascular disease. That's still number one. And so even though we want to know about prostate cancer and make sure that it is not a problem in your lifetime, we also want to make sure that the rest of you is healthy too, right? It doesn't make any sense to treat one thing if another thing is going to be the bigger problem. So that's a really, really important message. Sometimes patients think that if I just go and find the right supplement at the store, that's going to be safer, more effective than all this stuff the doctors are selling. And I will say that oftentimes we actually don't have a lot of good data. Sometimes it just hasn't been tested. So you have to be very skeptical of some of the claims you see online, ivermectin and such. But here's an example of a trial that was actually done with vitamin E and selenium. These are sort of over-the-counter supplements. And not only did they not help, one of the arms actually looked a little bit worse in terms of prostate cancer incidence. So you can't assume that just because it comes from the natural foods aisle that it's safe and effective. Sometimes I think men in particular have a real fear about how a diagnosis like this might affect their ability to take care of their families, to do the work that gives meaning to life and allows them to provide for others. This is a very understandable concern. I will say that most of our patients don't have to take significant time off. There are a few things that alter life a little bit in terms of post-surgery restrictions or radiation schedules. I have a lot of patients, even those with metastatic disease, who are going about their lives and really living life pretty normally. Now, some are concerned about how much they're going to have to pay for their treatments, and this is potentially a real problem. We do try to work on this a lot. In my world, the biggest issue tends to be for some of my advanced prostate cancer patients. Some of the pills that we prescribe are ridiculously expensive, but we have a lot of ways of working on that between insurance, patient assistance funds. We have in our group an excellent pharmacist who really helps people navigate that and make sure that we don't get stuck with a big bill. I think lastly, we're at an academic center, and so we are always interested in the idea of research, but for many folks, this is a scary concept, and they come to us saying, I don't want something that's experimental. I want to do something that I know works. And so I think that there's some misconceptions out there about clinical trials. Some folks think this is only if you got no other options, and that actually is not the case. Many of our trials are very early on, trying to do a better job with what we already have. Sometimes people think, well, I can just come back to this, if I'm sick in the hospital and then, pull a Hail Mary. And it turns out that's not true either. It takes a long time to get trials set up. Clinical trials don't always test totally new experimental drugs. Oftentimes, we're testing drugs that have been through a lot of testing beforehand. They're into what's called phase 2 or phase 3, where you're really trying to figure out, what's the optimal way of using them. There are phase 1 trials out there that are testing pretty new things, and those are important too, because every drug that we have now, someone brave enough earlier on had to go through a phase 1 trial to figure out what's the right dose, what's the side effects. But this is a minority of the trials that we do. Sometimes people assume that there's going to be a sugar pill or a placebo. I can't think of the last time I've had a trial open that had this. That's very, very rare these days, just because we got so many options, and it would be, unethical and unhelpful to compare it against nothing. Sometimes people are worried that they're not going to know what they're getting, or their doctors won't know. And it turns out, again, very few of our trials these days are actually blinded. Not all clinical trials are even randomizing people, saying, half get this, half get that. Some are just treating everybody the same way, or treating everybody the same way, or adding something to that standard. So there's a lot of different designs. So we covered a lot of ground here, and I'll be interested to hear what questions folks have. But importantly, it's important to know where to turn for support. So I think events like this are huge. And I wanted to highlight the Prostate Health Education Network, specifically for Black men with prostate cancer. There's a support group that I help co-advise called the Boston Prostate Cancer Support Group. We've got a website, we got virtual meetings first Monday evening of every month. And your primary care doctor and your community members are really, the folks that you probably trust most of all, and certainly should harness all of those tools. So thank you so much for your attention. Again, look forward to your questions.
Thank you so much, Dr. Einstein. And like I said in the beginning, we have a wealth of information that helps pass any misnomers about prostate cancer. When you hear cancer, Dr. Einstein, you are so true. When you hear that word cancer, it's such a heavy weight. I've worked with a lot of veterans who currently have gone through prostate cancer treatment or had prostate cancer. One of my veterans fought 40 years dealing with prostate cancer, and one of his prescriptions, one, was $30,000. And the government did pick that up for him. And it was an extend of life situation at that time. But you said so many great things, and I'm sure we're going to have some questions once we get to the question and answer. But thank you so much. This is the kind of expertise that allows us to go into the field confident. The military gives us things that may extend our life. This extends other people's lives. So it's a great opportunity to get that information. And thank you, Dr. Einstein. And you said something that sparked my attention, no rectal examination. You're going to be a friend of mine if that's the case. We'll go to the MRI route, but thank you so much. And thank you so much for that presentation. It's remarkable. Thank you.
My pleasure.
At this time, as I said before, leadership reflects performance. One of the heavy lifters that's on our team that I'm about to introduce is an international leader in the fight against prostate cancer and lifelong advocacy for health equity. Dr. Stern is the founder, president, and CEO of AdMeTech Foundation, Boston-based nonprofit organization. For more than 25 years, she has been leading research, education, advocacy for advancing early detection of prostate cancer, critical for saving lives, reducing health disparity. Dr. Stern is the daughter of a prostate cancer survivor, and her mission is personal and urgent: to make sure no man dies because of his cancer was found too late. Under her leadership, AdMeTech has become the driving force for the first U.S. congressional hearing on prostate cancer. That's major. And for the Massachusetts legislature to become the first in the nation to recognize prostate cancer as a public health priority and leading health disparity. In 2016, Business Boston Business Journal named Dr. Stern as a woman of influence for her work on the AdMeTech Foundation Prostate Cancer Program. She has served as a faculty member in radiology at Mass General Beth Israel Children's Hospital of the Harvard Medical School, and is a senior leader at the National Cancer Institute, National Institute of Health, U.S. Department of Health, Human Services, and an advisor to the National Academy of Medicine, advisor to U.S. Congress, U.S. President Cancer Panel, Vice President Biden Cancer Moonshot, European Union, and other international organizations. Ladies and gentlemen, one of our anchors, Dr. Stern.
Thank you so much, Steve. I appreciate your introduction. It's great to see everyone again. It's great to see people we've been working with since 2015. I would never forget our first meeting in a Lincoln congregation in Reverend Creighton's, in Reverend Creighton's church. Great to see old friends, great to see old partners, exciting to see new people at this event. At this point, I will ask my staff to use the video. After many mishaps with PowerPoint presentation, we switch to video presentations. My name is Faina Stern. I'm a physician and president of the AdMeTech Foundation, a nonprofit organization leading regional, national, and global programs in prostate cancer education, research, public awareness, advocacy, and clinical care equity. I'd like to thank Brockton NAACP for partnering with AdMeTech for over a decade, for undertaking a joint prostate cancer awareness campaign in Plymouth County and surrounding areas. Also, I'd like to express my gratitude to members of the Brockton delegation to the State House who made our programs, including today's event, possible. In my talk, I'll describe AdMeTech Foundation's history and our prostate cancer program established to lead cutting-edge advances in patient care and eliminate health disparities. In particular, the focus of my talk is on the AdMeTech Foundation Prostate Cancer Equity Resource Project, created to ensure that all Massachusetts men have access to high-quality care, including the best-in-class advances in screening, diagnosis, and treatment available today. History of AdMeTech Foundation and its programs is closely tied with my own professional and personal history. Since 1990, I was head of diagnostic imaging research branch at the National Cancer Institute. In this position, I was leading development of national and international research policy and related strategy and programs for the National Institutes of Health, Department of Health and Human Services, and U.S. federal government. Our priority focus was on the advancement of breast cancer imaging. We created digital mammography, breast MRI, advanced ultrasound, and molecular imaging for improved patient care. We also worked on teleradiology for image transmission for a second opinion, so that we could bring world-class expertise to underserved, rural, and remote communities. These breast cancer programs led to transforming screening, early detection, and treatment of breast cancer and reducing health disparities. Precision imaging made it possible to improve screening and accurate diagnosis, critical for early detection and saving lives for all women. To create minimally invasive lumpectomy, when we identify and remove only a part of the breast tissue containing tumor. This minimally invasive lumpectomy replaced radical surgery such as mastectomy, when the entire breast and surrounding tissues are removed. Lumpectomy is performed in outpatient clinics with minimal complications, pain, suffering, and costs. Precision imaging and early detection also made it possible to reduce health disparities in Black women. In 1996, while our breast cancer programs were well underway at NIH, I brought together the key leaders of government, medicine, and industry who recommended prostate cancer as the next national priority focus for several reasons. First, prostate cancer is the most common major internal cancer among men. It is as common among men as breast cancer in women. Prostate cancer strikes 1 in 8 men, while breast cancer strikes 1 in 8 women. And yet, prostate cancer diagnostics and care lagged behind breast cancer by several decades. Second, prostate cancer screening with blood test PSA was successful in identifying men at risk of losing their lives and in reducing mortality or death from prostate cancer. However, men needed accurate diagnostic tools that would make it possible to sort out if abnormal screening result was due to false alarm or due to a life-threatening prostate cancer. Accurate diagnostic tools would make it possible to create personalized and most effective plan for clinical care for each man and avoid unnecessary procedures. Third, treatment of prostate cancer, such as radical surgery, was highly invasive and traumatic, leading to prolonged hospitalization, difficult recovery, and unacceptable level of life-altering complications. Similarly to women with breast cancer, accurate imaging would make it possible to develop minimally invasive treatment for men with prostate cancer or male lumpectomy. Fourth, prostate cancer is a leading health disparity. Black men are 2.5 times more likely to die compared to white men. We did not see this level of disparities in breast cancer even early in my career, in the 80s and 90s. Finally, in sharp contrast to women with breast cancer, men did not have accurate imaging, leading to blind biopsies and treatment. Our work in breast cancer imaging created a blueprint for transforming prostate cancer care. At about the same time in 1996, I had a personal experience that left me rather shocked. A leading clinical expert in Massachusetts, chosen by me, examined my father and determined that he had a benign and common prostate condition. However, when my dad had an invasive procedure, he was found to have prostate cancer. It was stunning to me that the leading expert in a world-leading hospital did not have the appropriate tools to make accurate clinical diagnosis. This experience transformed my professional interest in prostate cancer into a personal mission to improve early detection and treatment of prostate cancer for all men and to reduce health disparities in Black men. If we made a difference for women with breast cancer, we could make a difference for men with prostate cancer. I mobilized other leaders of medicine, and we approached National Cancer Institute and NIH in the hope to see an increased government investment in prostate cancer research. Unfortunately, in spite of our joint track records and a year-long effort, we did not succeed in convincing U.S. government. In response to the lack of support from federal government, by late 1997, we established AdMeTech Foundation with the mission to end blind patient care and create the future of image-guided, minimally invasive diagnosis and treatment. We call it the Manogram project. Since 1997, we have been leading pioneering research that resulted in creating and clinical implementation of precision MRI, molecular imaging, robotics for biopsy and treatment, and other precision diagnostics and therapeutics that transformed prostate cancer care. In 2005, we initiated a large-scale national public awareness campaign where is Manogram, prostate imaging for men. In 2009, we had the first annual Prostate Cancer Awareness Day in Massachusetts State House and proceeded to create a new model in public education. In 2011, as the result of our advocacy, Massachusetts legislature had set up a historic precedent by recognizing prostate cancer as the central healthcare problem in men, a leading health disparity and public health priority. In 2013, Massachusetts legislature established a prostate cancer program. It started as a research project that was seminal in making MRI a new standard in patient care for guiding biopsies and treatment. So in 2014, we expanded our efforts in public awareness, reaching countless people. In 2016, we established annual global summit on precision diagnosis and treatment of prostate cancer, which, unlike other medical educational events, brought together leaders of all medical subspecialties involved in patient care, took down interdisciplinary silos, and became instrumental in creating a broad international consensus on the best clinical practices and research priorities. In 2021, we had launched Prostate Cancer Equity Resource Project to make sure that all Massachusetts men had access to the best care available today. And in 2023, we created an international working group in minimally invasive treatment to expedite clinical testing and implementation of male lumpectomy. Our statewide program in prostate cancer created a Massachusetts model of national and global leadership in public awareness, medical education, research, and health equity. AdMeTech is leading prostate cancer program in cooperation with multiple organizations, including American Cancer Society, leading state clinical experts, and multiple branches of the NAACP and Latino health insurance program located across the state. Our primary focus is on high-risk men, Black, Hispanic, and Latino individuals, and all men with family history of prostate cancer and increasing age, 50 and older. Our public awareness has focused on the importance of screening and early detection, critical for saving lives. Since 2019, we reached well over 71,000 people. The centerpiece of AdMeTech's medical education is annual global summit on precision diagnosis and treatment of prostate cancer. Our summit has been recognized as a seminal event in shaping the state of the art and future vision for patient care. Our summit brings together the key international experts representing every clinical field to review the best emerging clinical practices and research needs and priorities. There is not a corner of the world that has not been represented at this event. The latest 9th annual conference took place only in September 2025, several weeks ago. Our summit demonstrated that early detection saves lives and eliminates health disparities. With early detection of prostate cancer, every man is alive in 5 years. In sharp contrast, with late diagnosis, when cancer is spread outside of the prostate to other organs, only 28% of men remain alive at the same time. Early detection is particularly important for high-risk individuals, including any man with family history of prostate cancer or Black men who are twice as likely to die as white men. In prostate cancer, screening with blood test called PSA is the best tool we have for prevention and early detection, critical for saving lives and reducing health disparities. If we look at the reduction of mortality per year, PSA blood test is the most successful screening tool we have had in the history of cancer. It is important for men to take charge of prostate health. To do that, it's important to know your risk factors, such as blood heritage, family history of prostate cancer, particularly when your brother or father had this disease, and increasing age, 50 and older. You can assure early detection during annual visit. Ask your doctor to discuss if PSA blood test and digital rectal exam are right for you. You need to talk to your doctor starting at the age of 40 if you have risk factors I just described, or at the age of 45 if you do not have these risk factors. Before screening, it is important to avoid exercise or sex, which may impact your testing results for at least 2 days. After screening, you need to ask your doctor if your test is normal or if you need to see a prostate cancer expert for further evaluation. Our summit concluded that equal access to high quality care is the key factor in improving patient outcomes for all men and eliminating health disparities in Black men. It is particularly important now with so many novel diagnostic and therapeutic approaches, ensuring high quality, personalized patient care. Without equal access to these advances in patient care, we will see a widening gap in health inequalities, including survival and mortality. Consequently, AdMeTech launched the Prostate Cancer Equity Resource Project in Massachusetts in collaboration with Mass General Brigham, UMass, and other clinical institutions, with the mission to save lives and deliver high-quality care for all. More recently, experts from Beth Israel Lahey joined us. Supporting organizations include Latino Health Insurance Program and multiple NAACP branches located across the state. Any Massachusetts man age 40 and older is welcome to participate. Our priority focus is on Black, Hispanic, and Latino men who are at high risk of prostate cancer, delayed diagnosis, poor quality care, and death. Our goal is to expedite access to leading experts who use the most advanced approaches to screening, diagnosis, and treatment available today, and to support men every step of their medical journey. This program helps men to find an expert for the initial or a second opinion in person or virtual visits. We believe that in Massachusetts, with its leading hospitals and universal access to care, our prostate cancer equity program will be able to eliminate health disparities. Experts of the prostate cancer equity program can address any questions about prostate health, from assessing an individual healthy man's personal risk of cancer longer term, to informing men about all available options before and after screening, biopsies, and treatment. We are committed to supporting men during every step of their medical journey to ensure that no man is left behind or struggling alone. To achieve this goal, we created a streamlined process of patient referral and care, reflecting how doctors involved in this program would like to take care of our families and friends. This process consists of several components. First, AdMeTech Foundation's team collects basic information and match individual patients' needs with the appropriate state's experts for clinical care. Second, a clinical organization designates a patient navigator to expedite a medical visit and related needs, including scheduling, registration, transportation, financial, and insurance assistance if needed. Third, if an expert recommends any next steps, AdMeTech's team and patient navigator work with men on the appropriate follow-up, such as, for example, additional testing or treatment. I'd like to provide a few recent examples of how PCE Resource Project has been making a difference. In December 2024, Martha's Vineyard NAACP asked us to help an older Black man who expressed a lot of confusion and concerns about his care. AdMeTech staff contacted Dr. David Einstein at Beth Israel Lahey, who agreed to provide a second opinion. In February 2025, this man and his wife had a visit with Dr. Einstein, who provided a clinical consultation and contacted the regional clinical care team to ensure a coordinated approach. In March 2025, this man and his wife described that as a direct result of Dr. Einstein's consultation, they understood their situation for the first time and became clear about the next steps. The second example involves George Brickhouse, who in December 2022 took part in the virtual meeting of the PCE resource organized by Steve Bernard, immediate past president of Brockton NAACP. During that meeting, George expressed the lack of trust in his care and difficulties in scheduling prostate MRI recommended by his doctor. We got concerned, and after the meeting contacted Steve and asked him to explore with George if he would be interested in our PCE resource. In early 2023, George contacted us and we suggested for him to consult with Dr. Kwok Ding Trink of Mass General Brigham, who can ensure the best of last care, including high quality MRI. George has been so happy with his care that he became an advocate for our prostate cancer equity resource. In late 2024, Dr. Trink moved to Pennsylvania due to academic promotion. In March 2025, per George's request, we referred him to Dr. Adam Feldman, another leading clinical expert at Mass General Brigham and our partner at that clinical institution. Emma Coyer serves as a manager of the Prostate Cancer Equity Program. Emma is assisted by Erin Roberts, program coordinator, Craig McClay, patient educator, and other members of the AdMeTech Foundation's team. We serve as your individual patient care advocates. When you come to us, Emma will work with you, our team, Mass General Brigham, UMass, Beth Israel, and other clinical partners to expedite medical visits and address any needs you may have. Together with clinical experts, we empower each man to make informed choices in patient care that are right for him before and after screening, biopsy, and treatment. If you have any questions or need assistance, please contact Emma by phone 617-523-3535 or by email coordinator@admetechfoundation.org. Thank you for your attention.
It's a great pleasure for me also to introduce Emma, who will manage our prostate cancer equity program. And Emma will provide her name, her email, and phone number. So if you or anyone in your community, in your family, among your friends need help, you will know who to contact. We stand ready to help any Massachusetts men who need help.
Thank you so much. I'm sorry, go ahead, Dr. Stern.
Back to you, Steve.
Oh, thank you so much. This is the type of relationship that we are talking about. It definitely educate and equipped us to go out into the field. These testimonies are remarkable. And I am so encouraged to hear the growth, the expansion from once I last done my MC at the Shaw Center, probably some 10 years ago, to now, and it's full circle. And to hear all this great information, 71,000 contacts, and say one or two of those become advocates and follow your model. Everyone is looking at Massachusetts. We are one of the original 13 colonies, and still we have that muscle memory to stretch out into the nation with these types of researchers, these types of leaders, and everyone is paying attention. So thank you so much for that, Dr. Stern. We're going to have some questions and answers from our audience. If there's anyone that has a question, please feel free to raise your hand and we can chime in. And I would just like to ask Dr. Einstein, I do have one question concerning cost for treatment. And is there any support networks? And have you seen any pushback from MRIs or PSAs, one or the other? What would be your take on cost for treatment and support network? Because that's the scary part, sir.
Yeah, I mean, last thing you need is more things to worry about amidst a scary time, right? So fortunately, things have gotten a lot better. So for example, the use of MRI for people who hadn't yet had prostate cancer diagnosis used to be something insurance companies would not cover. But we now have sufficient data to really get that covered. And it's really on guidelines now. So that's usually not been a big problem in the modern era. We don't tend to see a lot of problems with getting things like surgery or radiation covered, things that are injected in clinics, like some of our hormone therapies, we don't tend to run into big problems with. The big problem I face is really some of the oral things that we prescribe in clinic for typically folks with more advanced disease. And to work on that, there's a number of different sources, but oftentimes there's what's called, for those who need them, patient assistance funds that are sort of specific things set up for this purpose, sometimes with the help of the company that, is trying to make sure that people have access to their drug.
Yes,
And that again is where the pharmacist help is super critical. Sometimes people have to apply for these types of programs. They, sometimes want a little bit of information about, income and such. But I think that in general, we haven't had major problems with that. And again, we don't tend to see people needing to take tons of time off work. If for whatever reason somebody did, usually I can write a letter and, get things by
yes.
because there's a pretty good reason for it.
Thank you so much. And like I said, sometimes people perish for lack of knowledge. You choose not to look in those areas, but this is so helpful to get us support. So we're going to open this up to the honored guests and our memberships if they have any questions that came up to their mind. Anyone?
Sure, I can go if no one else is. I didn't raise my hand. Is that okay?
No, that's not okay. We're going to give one demerit for it, sir.
I appreciate you all. And once again, thank you, Dr. Stern. Thank you, Dr. Einstein, President Ellis, and of course, Steve, for being here and our distinguished guests. I'm looking at some great politicians that have been very supportive, including our outgoing mayor. But I typically have to ask these difficult questions, and I don't mind doing so. So I'm going to ask two important questions. The first question is that although I appreciate that there was some consistency with regards to the Biden administration and cancer research, I'm not sure that there is consistent funding with regards to that, the NIH funding, when it comes to new technologies, especially around prostate cancer. I guess my question is, have you all heard, Dr. Stern, Dr. Einstein, has there been a cut in NIH funding under this current federal administration that would be detrimental to the development of new technologies?
David, do you want to comment? You are right there on the front lines in academic community at the cutting edge of research. Do you want to comment?
Sure, it's a problem. It's absolutely a problem. And it's incredibly frustrating because usually cancer is not seen as a very partisan issue. And so, NIH itself has been becoming harder and harder to get funding from over the years. That's not a new thing. But now, I mean, you're basically playing the lottery. You really are gambling every time you try to put in a grant. We're talking 4% or fewer of grants funded. Department of Defense prostate cancer budget this year was slashed. So, there's going to be far fewer awards going out. There's a real concern about, things that, could be developed that won't be. And so, we have to do whatever we can, but that's definitely above my pay grade. I will say that, in the clinical research side, things that are sort of already being tested in humans.
Yeah.
Oftentimes that's being done a little bit more by industry colleagues from companies, which has pros and cons, but that's just sort of the system that we have. So NIH funding tends to go to sort of more basic research.
Mhm.
And then a lot of the clinical development is usually done by companies. The companies themselves, there's the economy goes up and down. Sometimes they're a little bit more able to do things than others. So that hasn't been affected as directly by federal changes. But I think more than ever, we're going to be, reliant on that kind of source and on philanthropy, because, this government investment hasn't been as reliable as we'd like it to be.
Doctor, can I just ask you, just as a follow-up, as the NAACP is a civil rights organization. We're concerned about Black Americans and others. And one of the things that we all have done because of the statistics, we often talk about this in terms of Black men. I mean, we use that label, or others of African descent. And I'm not trying to pick on the current administration. That sort of labeling has been detrimental to DEI, quite frankly. And I'm kind of wondering, when you look at funding that says we need to do this investment, prostate cancer, it's affecting Black people, and you may have people in an administration that says, so what? How do you respond to the community if you hear something like that?
I think we do what we have control over. And so certainly we've got a lot of power on the ground to change the way that we care for folks and develop these kinds of networks. I think that, we can push as hard as we can at higher levels and say, why it's so important. But I think that, in the current period that we're in, when we put in grants, you cannot talk about certain issues anymore.
Right.
And, there are still organizations out there, aside from federal government, that are interested in those problems. And so then you go to those organizations and say, okay, all the more reason to really focus in on this now.
AdMeTech Foundation is lucky that we are getting state funding. I think Bridget is still here. And we've been working with Bridget first as Chief of Staff for Rep. Cassidy, and right now as a representative. She's been an incredible champion for us, together with Senator Brady, Representative, oh my goodness, Rita, and
yes.
Yeah. And many others, many other members of the Brockton delegation, many senators and many representatives who support us beyond Brockton delegation. And our plan is to have more events than we've ever had, more public awareness, outreach, community outreach, to have more community outreach coordinators than we've ever had, and to step up our efforts to make sure that men are served, particularly vulnerable men.
Thank you,
so
Dr.
much.
Stern and Dr. Stern and Dr. Einstein. One quick question, one more around trust. So we all know that Black men specifically do not have a trust of the medical community. And I'm just kind of wondering, in this atmosphere of change and also going through a lot of new trauma around racism, but within the healthcare field, I'm kind of wondering what can be done differently from the perspective of hospitals and medical offices in order to build this trust that we're all looking for around prostate cancer screening. And Steve's looking at me, so I'll be quiet. Bye-bye.
Yeah, Tony, I think the key issue is actually for us in medical community not to show up unannounced on the doorstep of Black or brown communities. It is critical for us to have partnerships with trusted organizations like NAACP and its leaders, with trusted community leaders who will introduce our work. These people will not necessarily trust us unless we have a relationship with them, unless we earn their trust. Okay, but people will trust leaders of their communities. People will trust lawmakers they elected, they chose to represent them.
The clergy.
And clergy. So it is, when I talk about leaders of community, of course, pastors, are very much a part of it. So it is the partnership, doing this in integrated fashion, doing this in partnership is absolutely critical. We can have the best tools in the world, but if people will not come to us because they don't trust us, we cannot help them. And that's why it is this partnership that is so critical. We are building infrastructure in medical community through Prostate Cancer Equity Program, and we build partnership in order to have men come to us. And I must say that you probably surmised for my examples that various branches of NAACP have been a major source, and Latino Health Insurance Program have been the major source of referral of patients to our Prostate Cancer Equity Program.
Thank you so much. Thank you so much for the questions. At this time, we're going to have Reverend
excuse me, Steve.
Oh,
before
yes.
we do that, I have can I just say something? Dr.
You have the floor, Madam
Einstein.
President. You're the president.
Thank you. Dr. Einstein, you have been a guest physician on numerous occasions, and I for one, I'm always impressed with your presentation because it's so straightforward and it's so easy to understand. And the way you answer questions of the guests, I think is remarkable. But AdMeTech and the NAACP truly, truly appreciate you. And to show our appreciation, we would like to present you with the 2025 Leadership Award. The award is going to come your way in a few days, but we want you to know that we truly, truly appreciate our partnership, and we hope we can continue this partnership in years to come. So thank you so much.
That's incredibly kind, and I really appreciate the opportunity. Opportunities like this don't come along every day, and it's really nice to sort of step outside of our clinic and get outside of our own walls. I will say the last time I think we were all talking with each other, I was in the midst of a pretty bad bout of flu, so I'm really glad to be back in much better shape than last time.
Amen.
It's good to see some familiar faces.
Thank you. Okay.
Congratulations, sir. And these are the conversations that need to be had, because when we don't have these conversations, we find ourselves behind the eight ball. We find ourselves in detrimental situations like that. So having those hard conversations, you'll find the results by not having them are worse than having those conversations. So thank you for those questions. Thank you, everyone. And these gentlemen that you see behind me, they have given the opportunity for the belief in a more perfect union. The group that we have assembled before us, it just enlightens my belief that there's enough of us. There's enough of us to form a more perfect union. So thank you so much for all our participants, all our speakers. We're going to ask Reverend Creighton if he would come in and do his closing prayer, and I will give the final remarks. Reverend Creighton.
We thank you, Lord, for visiting us one more time this evening, that we will leave this place with a new sense of urgency, that you empower us, Lord, to reach in an effective way, Lord. We thank you for what you've already done. We're going to give you all the glory and the praise. Author finishes name, I pray. Amen.
Amen. And we are on time, and we are on point. So at this time, we're going to be closing, and we're going to ask Madam President if she has any final words as we close. Thank you.
I think it was a remarkable program. I thank everyone for tuning in. I think we have a lot of people online and actually watching this presentation. I'm always impressed, and I just want to say thank you so much, and I look forward to the next one. Steve?
Good night, everybody, and you are now an advocate for prostate cancer awareness. Go tell somebody, I know we will, and create clones. Thank you very much.
Bye.
much. Have a great
Bye-bye.
Good night. Thanks again.
Happy Veterans Day.